Hi, I'm Jaimie Walker, and I'm giving my informative speech today to my lovely audience. So, until I worked for an organ procurement organization, I didn't think much about organ donation. It was a decision that I had made in the driver's license bureau that was like any other decision I would make on a normal day, whether or not I added a car wash to my gas purchase, or whether or not I got cash back when I went to the grocery store. It wasn't something I thought would ever personally affect my life, or a situation that I thought I would ever be directly involved in, really. The day I started at LifeLink, which is the organ procurement organization that I work for, I met Christine. She was a kidney and pancreas recipient, and she had also received another kidney after her original graft had failed. So because of the gift of two very selfless people, Christine was standing in front of me that day. It was an interesting first day at work, needless to say, but I learned then the importance of the decision that I had made in passing. Today, I'm going to share with you some details about organ recovery and transplant, why it's important, the professionalism with which it's carried out, and the benefits for those patients who receive a transplant. Organ recovery transplant is worthwhile, is a heavily involved medical procedure, and creates benefit from a terrible circumstance. First, I'll start off with some history. In 1954, believe it or not, 60 years ago this year, was the first successful kidney transplant. That was from a deceased donor into a living patient, and that patient lived for quite a while. That's according to the United Network for Organ Sharing, which monitors all of the organizations like the one I work for. Since then, the field has grown to include heart, lung, liver, kidney, pancreas, and intestinal transplant, and also whole tissue transplants like face transplants, and also hand transplants for those who have lost motility in their hands or feeling in their hands. So if someone is to lose a limb, science now can use a deceased donor's limb and give them back motility in that hand, which is pretty incredible. According to Donate Life Florida, the second highest ranking organ donor registry, is in Florida. So we've done a wonderful job of registering people to be organ donors. However, we actually have one of the larger lists as well. We have 5,200 people waiting for organ donations currently who are being actively treated by transplant centers. According to the national average, we have about 122,000 people a year who are still waiting for organ donation, which is quite a lot of people. The number compared to our population doesn't seem high, but when you think of each individual waiting for an organ, it's really quite a list. So, though much progress has been made in the field of donation, we still have a long way to go. This need may be better addressed if the community is educated on the need of organ donation and what that decision actually means. So, who can donate? We say if you'd like to become a donor to register as a donor because of scientific advances and advances in the healthcare field in general. When that time comes, if something unfortunate should happen, you never quite know what the circumstance is going to be scientifically at the time. People who have died brain death, meaning there's no neurological function whatsoever and have been declared brain dead by two individual doctors not affiliated with organ donation, can become donors. Or if that person or their family decides that they would like to extubate because it's anticipated that that person would not live without mechanical or life support, then that person, if they meet specific criteria, may also become a donor. However, donation never goes forward without the direct consent of the individual involved or the consent of the family. And even in that instance, we are heavily regulated, and doctors who are licensed to do so have to declare that person an eligible donor. Recovery of organs takes an army. There are about 45 staff members involved, from hospital staff, organ procurement staff, and transplant staff to make one transplant happen. So needless to say, in the course of around 24 to sometimes up to 7 days, 24 hours to up to 7 days is for one transplant. So it's quite an involved process with lots and lots of educated people involved. And very specific timeframes are required for the transplant of those organs. Then they're matched to waiting recipients according to a national waiting list and also the region which that patient lives in and their need for that organ. Follow-ups done with the recipients and the donor families to make sure that all families have their physical and emotional needs met. So counseling is available not only to donor families after their loved one has passed away, but is also available to the recipients should they have a hard time coping with that reception. So now that you're aware of some of the facts and process of donation, I want to let you know a little bit about the recovery and the good part, which is people living on after donation and after they've received that gift. Obviously, there are health benefits for recipients, as many of the recipients have a prognosis that would otherwise be fatal did they not receive a transplant. There's also comfort for donor families knowing that their loved one has helped someone in that unfortunate circumstances. In addition, there's financial relief for the healthcare community. According to the Medicare coverage guidelines, which is a national average for healthcare in general concerning insurance, it costs about $20 to $30 per treatment out of pocket for a patient every time they receive dialysis. Dialysis normally occurs 2 to 3 times a week, so you're looking at approximately $90 to $120 a week, which gets very expensive, including medication. The average transplant costs a patient about $4,000 out of pocket, which is equivalent to about a year's worth of dialysis. However, that patient no longer has to undergo dialysis and feels much healthier. So in the long run, there's less cost to our nation. For subsidized healthcare, there's also less cost to the patient overall. In conclusion, organ recovery and transplant is not only life-saving, can be life-improving, and helps families in need when the terrible circumstances happened. It relieves our healthcare system of unnecessary costs, and it also helps us to share from one another and establish a personal relationship after something tragic has happened. It's a very important and very professionally mannered healthcare industry, and is always going to be a help and always going to be a need in our society until we develop something otherwise. There's a quote from Donate Life Florida's 2013 annual report that is a recipient and also a living donor. Her name is Lily Tomlin, and she said, "I always wondered why somebody doesn't do something about that, and then I realized I am somebody." So that was a very neat perspective. And if you'll look and see, I've provided you with the cycle of organ recovery and donation, so you can look and see how involved that process is. So earlier when we went over who exactly is involved, this guideline that I've provided kind of goes over that. So I thank you so much for giving me your time today, and hopefully you learned a little bit more about the organ recovery and donation process. So, does anyone have any questions? Yes?
Okay, so like, why don't you guys just like take all the organs from dead people? Like, why do you guys have to have them be an organ donor? You get what I'm saying?
Because we like to respect people's wishes, and sometimes people don't want to donate. So it's really a personal decision, and it's not a right or wrong one to donate or not to donate, but some people, because of their religious affiliations or their personal beliefs, don't want to be organ donors, and that's A-okay. Yes? They do not. Unless there is specific authorization from a person, first person, meaning they've registered as a donor, or if we have specific authorization from the family, technically the legal next of kin, we do not recover any organs. So it's always consent-based. Yes?
How do you sign up to be a donor?
I am a registered donor.
So how do you sign up?
Oh, I'm sorry. It's online. You can either go through the Donate Life Florida website, and so if you look up, you go into your Google tab, you can look up Florida Registry, go that way. If you have a Facebook, there's a link on Facebook now that will take you to the registry where you can register to become an organ donor, or you can put it on your license. So, Jordan.
What is the transferring of organs like? So they take them from the deceased person and then like, I mean, you know, all I know is like from movies where there's like a special cooler or something, you know, like what is that like?
There's actually an entire industry based on the transferring of organs, and companies that specifically courier organs and human tissue. And what we do as a company is we have a box that is a cardboard box that's been specially insulated and made to hold biomedical waste, or in this case, something that's actually going to be used. We box that organ, and we have teams that either fly the organ like you would fly your suitcase to where it's going, or we have a courier come pick it up and transfer it. So it has a buddy all the way through its journey. Yeah. Anyone else? Chelsea.
What is your part in this process?
I take care of the families after someone has become an organ donor. So after someone has passed away, I work with the family and refer them for support services. I also we'll send them different commemorative items from our organization as a thank you to them. So I provide support and also provide kind of a thank you in the follow-up from our organization. Yeah.
What kind of process does somebody have to go through to decide they really want to do full surgery, receiving an organ process? Because that's a very serious decision.
You have to go through counseling to be put on the list, and to be placed on the national list is a very long process. So you have to be deemed medically necessary for transplant, which is the first step, and then depending on which organ you're receiving, there are certain stipulations. For instance, if you're receiving a liver and you in the past have consumed maybe more alcohol than you should, you have to go through alcoholism counseling and be sober for at least 6 months. For lungs, you can't be a smoker. There are certain things like that, and there's a checklist for each organ.
What if it's like an emergency transplant?
If it's an emergency transplant, you move to the top of the list. Each organ has individual scores, so like for a kidney, it's a MELD score. So from 0 to 40, 40 being you're going to probably die today or tomorrow. If it's an emergency like that, your MELD score will be 39 or 40. That'll move you to the top of the list.
So do they still make you go through all of these steps later? Like if you need an organ today, but like, or have you already gone through those steps?
Most of the time, they'll make exceptions for listed patients if there's something like an emergency that comes up where they didn't know they had heart failure and all of a sudden this person's going into tachycardia. They're going to figure it out for that patient. Anybody? Oh, yes.
Do babies like at the top, like in your baby?
Pediatric transplants are actually very difficult to place because organ size is a factor in placing organs. So a lot of times the age difference is 12. So a 12-year-old can normally receive pediatric organs. Over 13, you need to receive an adult organ, and vice versa. So if it's a pediatric donor, a lot of times they go to kids. If it's an adult donor, sometimes they go to kids, but normally they need to go to adults because the organ's too large. Good? Does anyone have any feedback for me?
You did a really good
Go
job.
for it.
Yeah,
Thank you.
yeah, that was really good. Yeah.
Negative feedback.
I like it.
Anyone?
I would have been like,
Well,
let's
you
see.
stumbled a couple times, and you did a good job with your recovery.
Yeah, that's true. And you didn't.
I would say work on your conclusion a little bit just to smooth out some of the rough edges. Other than that, beautiful.
The opening was very interesting. You grabbed our attention.
Yeah.
Yeah.
And your
like you
pace was good, I thought. Your pace and tone of voice was very good.
Yeah, you didn't have to look down too much.
You gave a good,
Yeah.
clear picture of what you were trying to convey. I'm not confused at all about anything that you said.
Good.
Yeah. It was
Great.
very informative.
Awesome. Thank you so much. Perfect.